Hi, in this video we'd like to briefly go through what are some of the tests that you can expect for a potential miscarriage. Now this is especially suitable for those who have a history of repeated miscarriages. You might want to learn some information. Also, first-time expecting mothers, this is also some important information to help you educate yourself on this topic. So straight away into the topic, there's only two key tests that we want to do during the early stages of pregnancy, the first week, second week. This is when we commonly conduct two key tests. The first one is a blood test. Now, blood test, what do we look for specifically is the amount of HCG. Secondly is progesterone. So HCG is directly proportional to the health of your pregnancy, and usually every 2 weeks or 3 weeks it needs to increase 2-folds or 3-folds, and then only it gives us an indication that your pregnancy is actually stable and healthy. There is no complication that's going to happen. So for those who are observing low levels or fluctuating levels of HCG, then this could potentially develop into a threatened miscarriage. We might need to do some emergency management methods to figure out what is actually causing this. Otherwise, it may lead to a pregnancy loss. Secondly is progesterone as well. Progesterone is also very important. It needs to be high at a certain amount as well, certain levels. It needs to be hit a certain level so to indicate that the pregnancy is stabilizing. So we will look at both HCG and progesterone to see whether or not the pregnancy is doing well or not. Both these pregnancy hormones need to be at high levels. Then only we will pass the blood test with flying colours, so we don't need to be worried. Second is an ultrasound. Ultrasound, we've been looking at 4 key components of the pregnancy. And the first component is a gestational sac. Gestational sac is very commonly seen in ultrasound, which is just an empty circle in an ultrasound image. Now, why is it empty? It's because it may be very early, that the pregnancy has not yet developed. So usually your doctor will ask you to come back the next week or the next 2 weeks again for another ultrasound, and then you will see that the pregnancy has developed. So if you see that it's empty, do not be worried. It could be just a very early pregnancy still. So just by measuring the diameter of the gestational sac, we can already know the gestational age of the pregnancy. This is how we calculate the age of the pregnancy. Is it 3 weeks or 4 weeks? And it should be empty in the very early days. So second component is the yolk sac, which is the pregnancy, which is located inside the gestational sac, which is like a white ball inside the gestational sac. Presence of this yolk sac indicates that the pregnancy is sufficiently advanced, probably after 5 weeks, and it's doing well, it's growing. And measuring the yolk sac's diameter also lets us know the gestational age of the fetus. The third component is the fetus. So fetus is a sufficiently advanced pregnancy, where you can see limbs, blood vessels, the baby moving. And this is a very key component that we look for. And also at the same time, we can also look at potential abnormality, some genetic mutations of the baby. If any is present, we can take a look via ultrasound. The last thing is a fetal heartbeat. Around week 6 to week 8 also can be detected via ultrasound. So do not be worried if you don't detect fetal heartbeat during week 5 or week 6. Sometimes baby needs sometimes another 1 week or 2 weeks. So if you don't see the week 6, you probably see the week 7 or week 8. And when you see fetal heartbeat, you won't physically see a heart, but you can see the blood vessels that will later on develop into the heart, but they will be pulsating and they will show a very healthy heart rate of the baby. So these are the 4 key components that we want to look out for when we do an ultrasound. So let me do a quick recap. So 2 tests that we want to do to check whether or not your pregnancy is safe. Firstly is a blood test. We check for HCG, has to be high levels and also increasing. Secondly is progesterone, also similar, needs to be certain levels so that we know the pregnancy is stable and healthy. Second one is the ultrasound. We look for 4 key components. Firstly is the gestational sac. Secondly is the yolk sac. These two are present in the early stages of the pregnancy. And then thirdly is the fetus during second trimester, third trimester. Lastly is the fetal heartbeat. I hope you've learned some information in this video. The Antai Hospital specializes in the diagnosis and treatment of miscarriages and ensuring you a healthy full-term pregnancy. Get in touch with us today if you'd like to find out more or receive treatment.